This podcast is proudly brought to you by Rest Tonic, whose purpose is to enable well-being and success through the power of sleep. So this gentleman sitting opposite me has had me in several compromising positions. And bear with me on that, because Rob has been my chiropractor, my go-to sports doctor in inverted commas, anything when it comes to ailments that I've managed to, I suppose, stumble across them as I've gotten older. And it's Dr. Rob Beffa. He owns a business called The Practice, and he's been working with athletes for probably 150 years. He'll tell us all about that now. But Rob is someone that in my sportive journey, outside of being competitive in sport, just in terms of general lifestyle, has been instrumental in treating me. Him and I worked more closely together back in my corporate days with supporting an athlete portfolio that we managed. And Rob is, I would say, in many respects, very considered, well-rounded, and in some cases a thought leader when it comes to things like sleep, the importance of it, recovery, how it can relate to injury prevention, recovery, and all of those kinds of things. So I'm excited to have Rob on the other side of my table today, with no acupuncture needles in sight. But Rob, it's good to have you.
Oh, thanks, Doug. Nice to be here.
Rob, talk to me a little bit about you, so we can frame you up nicely for all of the listeners and your journey in this space as a chiro. You caught my attention when a lot of the conversations we had were more around understanding injury prevention. When I first came to see you, you weren't someone that jumped straight into manipulation. You were more interested in movement patterns and soft tissue and how that relates to. But can you give us a bit of context as to your journey in getting to where you are today?
Sure. In many ways, I regard myself as a traditional chiropractor, but I've always kind of seen that there's a bigger picture. There's a lot of backstory to any injury or person that walks into my room. And certainly getting to know some of that and offers a lot of value to any treatment. And so you got to look at the whole picture. So how they sleep, how they eat, how they train. And yeah, certainly if you see patients a few times, you get to know the kind of stress they're under and all that kind of stuff. And all of this adds up to the bigger picture of how the patient's doing. And so just fixing their back or their shoulder or whatever when somebody is training for something like Epic or Comrades or something like that is always felt like a bit of a, half a job. And certainly being able to, just advise patients and get an insight, has helped me build links with my patients, but also just improve the quality of my care. And the more we got into it, the more you find it's so pertinent because a lot of guys, particularly for big events, they're pushing hard, they're pushing the limit, but then you find out they're actually pushing the limit, and not just with their training. They've got small kids at home, they're not sleeping, big corporate job, they're under the cosh there, and sometimes something's got to give, and you got to figure that out for them. Sometimes, they're so deep in it they can't see it. So certainly it's helped me understand my patients, knowing about all the other stuff apart from musculoskeletal stuff. What's the backstory? So that's my journey.
And has that been your approach since the beginning, when you were in studying what you've studied and graduating and starting your own practice? Were you quite deliberate in setting your course, or is that something that's evolved naturally over time as you've worked with more people?
Definitely. I think it's something that's evolved organically. Certainly, I think I started out with a much closer and smaller horizon, but you quickly realize it's just not enough. You've got to figure out more, and it just helps a lot knowing what's going on. And so, no, it's definitely been an organic growth. And now it's become something that I invest in and I research and I read, and our podcast and all that kind of stuff, because there's a lot of new stuff coming out. And so now it's become a deliberate thing. But certainly it started organically, particularly when I was treating athletes.
And with your current workload, would you say you treat more, and I say this in inverted commas, normal people, or are you more focused on treating athletes? From my knowledge, you treat a wide range of clients.
I would say mostly it's your ordinary, everyday, person. But I enjoy treating athletes, and it does make up a big part of my practice is treating guys who are preparing for all kinds of races and all that kind of stuff. It's an angle I enjoy. It's something I pursue. So it's definitely not my stable. I would like it to be, but I've got to pay the bills at the end of the day too.
100%. What's interesting to me is how you've always emphasized the importance of that holistic approach, and you mentioned it now. Sure, there is an athlete in this context. We're talking in preparation to Sani to see, for example, where you would be potentially seeing someone for the first time, and it's okay, this is my training program, and this is what I'm feeling, and so on and so forth. But then at the same time, highlighting the importance of, if we look at the average age of the participant at Sani to see, dare I say it, I'm slap bang, I am that guy now, 44. Generally between 35, 44, probably in some of the most stressful kind of years of your life, where you are trying to make a name for yourself, whether you work for yourself, you're in corporate, you're also trying to hang on to a little bit of your youth perhaps, and how you used to perform sportively. When you're treating people, how closely related are those two things, and do you find people underestimate the impact that off the bike stress, for example, plays in your overall ability to not just function daily, but also to be effective in your training, and for your training to deliver results that you can see improvement in your performance?
Oh, I think it's huge. I think it's absolutely huge. I think a lot of guys don't realize what it takes to do, to do a full-time job, be a full-time parent maybe, and train for a multi-day race like that. And especially a lot of guys got very high expectations, and certainly much more so in the past, maybe a bit less now. Most of my patients were overtraining for their capabilities or what they had available to them for races like that. And they were going in properly overcooked. You could see that they were tired, they were fatigued, and a lot of that had to do with their lifestyle, the rest of their story, not just how much training they were doing. But certainly, if you're highly stressed and you're pushing the limit everywhere else, then maybe you can't push the limit with your training as much as you think. And that's where they were overcooking. I think, they're getting all the training programs and all that, but they don't take into account where you are and how much time you have available and how much sleep you're getting and all that kind of stuff. And so we were seeing patients properly overcooked getting to the line. For the most part, actually, for big endurance races, I always say my patients are more often overcooked, getting to the start line tired. And I'd say to my patients, that's like adding an extra 20% to your race. Because if the guy next to you is fresh or slightly undercooked, he's going to ride into himself on the race, and you're going to be the guy who's straining. And so get to the start line fresh. And it's amazing how Oaks found that hard, because everybody feels underprepared. They try to push a bit too hard. They don't feel like they're training enough. And it's hard to hold back. Yeah.
Always the South African mentality. When it's tough and you're taking strain, go harder.
Exactly. Yeah. And then they start fatiguing and everything, and they think, my numbers are going down, but the race is coming, so I need to train harder. And that's precisely the wrong thing to do. And then you see somebody cook. Yeah.
So you've often spoken to me whilst I'm in the throes of a pain-induced spasm because you've just hit something in my trap with a needle, about the link. Cortisol, something that you've often talked to with me about, and my personal journey, of course, and in adrenal fatigue and other challenges I've faced outside of physical injury. But then also you've talked a lot about central nervous system and how closely linked those elements are, and that there is ultimately one remedy that's right out there with it's kind of an easy solve, but seemingly difficult for all of us to do is sleep. In your learnings and in your journey, how important, it's a silly question, we know it's important, but just how important is sleep, and what are the links between that and injury prevention, for example?
Sleep is massive. It's like fundamental. That's where big recovery happens. That's where your ultimate recovery happens. It's not just the days that you're not training or taking it easy. It's how well you sleep. That's where your brain recharges, repairs, your whole body recharges, repairs. And if you're not getting proper sleep, enough sleep, consistent sleep, you're cutting short your recovery. And especially if you are pushing if you're pushing the envelope on your training to try to get fit, and you're not putting in the recovery, then that's what's going to lead to overtrain and breakdown and lack of performance. So it's massive. It's the ultimate recovery.
So why is it so hard for so many of us, and myself included, to prioritize sleep? And when it's time to sleep, to be able to sleep?
I think one thing is competition for time. I mean, we're all trying to do a bit too much, and sleep seems to be the place that you can cut into. It's like the giveaway time it's a waste of time. And so you're trying to cut into there. And so you're getting up early in the morning to do that ride, and then you most probably do something like you're gonna watch an extra series on Netflix late at night to unwind, and maybe you're gonna have that with a glass of wine and stuff like that, which also breaks your sleep. And so consequently, that's what gets sacrificed. But also the research is coming in across humanity is because the invention of light and TVs and all that, we are getting much more sleep in the whole Western world. And that's purely just because of light and electricity.
Much less sleep.
Yeah.
Okay.
Because, before when there was no electricity, no light, when the lights went out, you went to sleep. And then you woke up with the sun. And so it's just that time has been invaded. And I think what happens is a lot of people get used to some feeling less than average. They take that as their normal baseline. They start to acclimatize to it. They get used to that. And part of that lower baseline is the lack of sleep. And they think that's normal. But if you want performance, you can't have that lower than average baseline. You've got to be at your best. And you've got to bring your A game, particularly if you want to ride a good multi-stage day race.
100%. I think and particularly important leading up to an event, months leading up to it, the week leading up to it, because typically in a stage racing environment, you're probably not going to get the best night's sleeps in a race village with your camping partner snoring. But what happens when you're sleeping? What actually happens in your body?
Well, you go through. So there's this thing they call sleep architecture, because basically there are different phases of sleep that you enter, and each phase of sleep seems to do different things. The research is coming in, and it's certainly by no means locked down what exactly happens, but they just do know it happens. So when you go into REM sleep, that's the rapid eye movement sleep, just before you kind of, in the early, late hours of the morning, kind of before you wake up when you dream, that's where it seems to be a lot of physical repair going to your brain and to your body. So that's organs getting their cells restored. That's all the toxins from your brain getting flushed out. That all happens only while you sleep, at no other time. And so to cut into that time or to do stuff that messes with the quality of that time is a problem, and it's happening often, and it's happening to everybody, it seems.
And sometimes involuntarily, when your child is waking up at 2 a.m. and breaks that rhythm,
yeah, absolutely,
it's difficult to get back down there.
Yeah, when the alarm goes off, and there's all kinds of things. And
there are no shortcuts, right? I mean, we've got different supplements we can take, and we can do cold plunges, but there's nothing that's gonna really.
No, you got to play the game.
You
got to play the game. You got to play by the rules for the most part. So it seems what's really important about sleep is consistency. And consistency means getting to bed at the same time, kind of waking up at the same time, and getting into that rhythm so that your body knows what's happening, when it's happening, and it gets conditioned and trained. If you mess with that consistency by continuously changing your bedtime or often waking up earlier than later, Your body doesn't know where it's at. So you've got to try kind of run a rhythm. And that seems to be the main thing. But also you've got to play by the rules. And the rules, if you're pushing the limit, then you have to play by the rules more. That's all there is. If you're on holiday and nothing's happening and you're not under any stress, you can lose the rules, you know what I mean? Because you're not under stress. But if you're pushing the limit and training hard and working hard, then you've got to play by the rules. That's what it's about.
Something you once shared with me, and I don't know if my memory is 100% correct, when it comes to stress and your body's interpretation of stress, is whether it is cognitive, physical, emotional, your body's interpretation of stress is the same and its response process is the same. So is that accurate?
Yeah, it's accurate to a large degree. I think it's accurate enough for most of humanity. We can put that in a parcel, certainly. And training hard and really pushing the envelope is a stress. And you've got to factor that in with, like you mentioned, emotional stress, work stress, relationship stress, financial stress, whatever other stresses you got on, because all these things add up. So exercise can be really great at helping you deal with stress and blowing off steam. But you've got to remember, when you are pushing the limit and you're trying to push the envelope of your fitness and you're putting yourself into the hurt box, that is stressful to your body. Now, you need that stress to grow your fitness. But at the same time, you've got to realize where you're at in the rest of your life. Okay.
That's the trick.
Yeah, that's the trick.
So when it comes to trying to balance all of this out, if you're someone that is in a cycle of pushing yourself from an athletic point of view because you're preparing for an event, you've also got a lot of work-life stress running in parallel to that, what are would you say are the long-term, short-term or long-term side effects of poor sleep in that type of situation for an individual?
Well, I think the first things you might notice is your resting heartbeat going up in the morning, your HRV, your heart rate variability, that might go out the window. But then your lack of motivation, so you will push less. You'll push yourself to the end less. You won't push yourself into the red zone as much. Your perception of effort increases if you are tired. Okay, but then certainly there's been a lot of research. If you are tired and underslept, then your decision making is going to be poor. So they've already done research. You change how you eat when you're tired. You'll have extra coffee when you're tired. You're more likely to chow the second croissant, never mind the first one, when you're tired. You're going to make all those poor decisions, but also then it's going to start affecting your coordination. And particularly on long races, if it's a 10-minute thing, it's not really a deal, but you're going to get a lot more fatigue on a long race. So that's your short term. Your long term is you're much more likely to go from that overreach kind of training perspective into overtrain. And that's when you are going to notice your performance is just going to start to drop. Your numbers are going to go down. And that's when you're more likely to start getting sick and stuff like that. Because your immune system will take a dive as well. So it affects your immune system as well.
So your body ultimately, if you push too much, will shut down essentially at some point to protect itself?
Absolutely. And there's some Australian researchers out there who are looking at this whole thing of, when does overtraining happen? And they've actually come up with the idea that it's actually, if you're a fairly fit athlete, it's hard to overtrain unless you are under-recovering. And so under-recovery is the big thing. If you're getting your recovery right, you can push the limit.
So it's a shift. It's basically flipping that on its head. Instead of overtraining, it's more conversation around under-recovery.
Yeah, absolutely.
That's an interesting narrative. I actually like that.
Yeah.
And when it comes to, we're talking here sleep deprivation essentially, and the association to the risk of injury increasing. Is that valid or is that overstated?
No, they've definitely noted mental fatigue and cognitive fatigue on testing individuals when they are sleep deprived. It can take a bit to get sleep deprived. So you talked about, when you rock up to the race and the oak next to you in the tent is snoring and you might not get your best sleep before the race. That's not so much of a concern, because if it's maybe 3 to 5 nights where you've had really poor sleep, and you've had, maybe 70% of your sleep. Then we're starting to get into that territory where the guys who are actually riding the race on the day should be worried. But if your build-up has been nice and consistent, then you don't have much to worry about. So 1 or 2 off nights, not a game changer. So long as you've got all your ducks in a row and you've got your nutrition right, you've got your sleep right, then you're good to go. So it's not as fickle as 1 night of bad sleep.
Okay. And in terms of mistakes that you see athletes make when it comes to their sleep, do you see them making mistakes? Is there any advice that you would have for athletes that are trying to improve their sleep? Naturally, you want to sleep for longer, or as long as possible. What's reasonable? 8 to 10 hours a night?
The research is coming in at somewhere between 7 and 9, and it changes for different individuals. So it's quite a broad field, but somewhere between 7 to 9 hours of sleep. But also we've got to get into the quality of sleep, and I think where guys break themselves is, one is, most probably the obvious one, is caffeine too late in the day. And remember that some of your protein drinks and your training stuff has got caffeine in it, and if you're taking that in the afternoon, that might affect the quality of your sleep that particular night. So the half-life of caffeine is quite long. It's like 10 or 12 hours. Wow. So if you are still having your last coffee at somewhere like 12 o'clock, by 10 o'clock, then it's kind of getting out of your system. Wow. So if you're having something later in the afternoon that has got caffeine in it, it's going to affect that night's sleep. And if you do that once, it doesn't matter. But if you're doing that consistently, then you're building the error, and it becomes cumulative. So that's the one thing. The other thing is just getting to bed too late. So that's your being on your screen, watching TV, something like that, just before you go to sleep, because that's stimulating your brain. It's switching your brain on. It's stimulating your brain. You want your brain to start winding down for that hour before you go to sleep. That will improve the quality of your sleep. What kind of other things?
We see some people wearing
sleep masks,
not glasses to combat
blue light.
Blue light. Is that legitimate?
No, it certainly seems a thing. You can even set your screen to lower light on your device, and certainly blue light to cut that wavelength of light that really stimulates your brain. But you also got to be careful about the content you're watching. If you're doom scrolling at night, on your thing, if it's like stuff that really, it's that flashing information that really is putting new information into your brain every 15 seconds as you get onto new. It's waking your brain up. It's stimulating your brain. So it's also the nature of the information you're watching. Remember, you want to wind things down because you want to get into that deep sleep.
And how long do you start winding down before you're going to bed? In your personal case, are you someone that prioritizes sleep?
Oh yeah, I'm a sleep junkie. I'm a much nicer person if I sleep. But also I like, there's a lot going on the health front now about longevity. And I don't buy into that so much. It's more that I want to feel vital. I want to wake up tomorrow feeling full of beans. And I want to wake up with enthusiasm. And then I'm much more likely to go do the things I enjoy. If I wake up feeling broken, then that's when I'm going to lie, and that's when I'm going to have extra coffee, and then the day escapes me, and I haven't done stuff that makes me feel good. So I want to wake up feeling vital. So I do protect my sleep. And certainly I start winding down most probably about somewhere 40 minutes before. I read a book, and my body knows 10 pages in, that's me done. I'm out. You know what I mean?
And exposure to screens and such, do you at that 40 minute mark?
Then I'm done with screens and stuff like that.
Okay.
So the general rule is the only time in the bedroom that you look at your phone is when you're standing. If you are lying down and looking at your phone in the bedroom, that's a mistake.
I like that.
Yeah.
I think I might.
Exactly.
I think I might make that rule at our house. Yeah. I make a lot of rules at our house, but not many of them are followed. And in terms of tech, we're all teched up.
Yes.
And we all wear
wearables.
Smartwatches and rings and all sorts of things. Do you those legitimately useful in tracking things like your sleep and help you become more aware? I do find myself from time to time looking on my Garmin at where my stress levels have been, and then looking at my quality of sleep.
Yeah, I think they can be very, very useful because, like I said to you before, a lot of my patients I found did not know when they were overcooking it. They had that dissonance. They were separated from that. They were too far in it to actually see it. And I think something like a wearable or a device giving you some feedback, and you see your resting heartbeat's gone up, or your heart rate variability has gone out the window, or your sleep tracker tells you that you've slept shit. I think all of that does help, and for those kind of individuals. The downside is I think a lot of oaks, might get too attached and just start panicking about the numbers, and they like referring to this thing every second and actually forget how they feel, because all those things are algorithms that are weighted and all that kind of stuff, and they might not necessarily apply to you. And if you've had a big training day, you might have less than average sleep because you've pushed so hard, because that does happen. If you push hard on a big training day, then that can disrupt your sleep for a day. And then also you might start panicking because your watch is telling you that things are going downhill, but maybe that's just a recovery day. So it all depends on how you interpret it. But if you're looking at that thing every 15 minutes, then it's a problem. If you're using it just to get a baseline and just to tap in and confirm what you're feeling, then I think it's great. But you've got to listen to yourself and how you feel and where you at, And I think that's what's important.
That takes time to develop.
It does take time to develop, and that's where maybe a wearable can help you figure that out a bit.
Yeah. If we look at cycling specifically in the context of stage races in South Africa, average age of the participant, a lot of people that participate in cycling haven't necessarily come from competitive sporting backgrounds. So for them, having an understanding of their body is possibly quite limited for no other reason than they haven't really been exposed to that level of training or work, or haven't felt it in their bodies. So I think for athletes, they're probably more naturally in touch with their bodies and what works and what doesn't work. Outside of wearable tech and so on, is there anything that a person that's been riding bikes for 3 to 5 years should be aware of as a marker? To be honest, if it wasn't for needing to earn points for Discovery, I probably wouldn't have the watch that I do. I like to just go out there and do my thing. I'm not training for anything specific. But tech aside, what else should people look out for?
I think one of the big things is waking up tired. If you're waking up feeling less than average, then something's up. Figure out why. If your alarm has got to pull you out from the depths of sleep, then you've most probably cut into your sleep. You were still meant to be fast asleep, and now your tech is waking you up. If you're kind of waking up the same kind of time or just before your alarm, you're most probably somewhere in your sweet spot. So how do you feel? Just if you need to take a nap during the day, if everything is harder, if you're going for a ride and you just notice your pulse, you're getting much more into your red line, and then things like that. But the big thing is, are you waking up tired?
Naps? What do you think of naps, daytime naps? Do you need them if you're getting good sleep in the evenings, or?
Well, some of the research that was done in Australia says actually athletes sleep less at night than other people, but then they make up for it by napping during the day. So I think naps, if you're pushing hard, naps is a good form of recovery. But it might only happen on a weekend, we're not in southern Spain here.
No, I was going to say, and for normal people that are working class heroes that struggle to nap.
Yeah. So that might not be attainable for everybody. But naps seem to be a very good thing if you can get them. A good way to recharge.
Do you enjoy a nap? I don't enjoy a nap. I always wake up after a 20-minute to 1 hour nap feeling horrendous. I don't nap during the day purely because of that. I'm a sleep at night, that's it.
It doesn't work for everybody. So that's what they call chronotypes. Some people operate better later at night, but they're not morning people. Other people are morning people but want to get to bed early. But that's coming under a whole lot of discussion as well, because they say that's maybe just a learned behavior. Yeah, but I hear you. And some people are much better off just sleeping once a night. And you've got to find out the thing that works for you. How do you, what can you do to make sure you wake up in the sweet spot?
Now, when it comes to things like sleep aids, we talked a little bit about it, or you mentioned it earlier, eye masks, earplugs. Personally, I take magnesium in the evenings. I found that helps a little bit. What else can people do to improve their sleep?
Yeah, certainly the sleep mask and cutting out any light can certainly improve the quality of your sleep, as long as the thing doesn't irritate you. Magnesium, you mentioned the magnesium threonate, that seems to work very well for a lot of people. Taking that just before going to sleep can, certainly you wake up with a sense that you've slept better, you've slept deeper. If you are really battling with your sleep and you're insomniac, then you might have to dig around and go see a health specialist and find out if you've got any underlying thing that's cutting in there. What other medication you might be on that might be affecting your sleep. I think the big thing is you got to play by the simple rules. Make sure you're getting to bed on time. Make sure you're not eating too late. That's another big one. Don't eat just before you go to bed, because you're not meant to digest and sleep. You're meant to just sleep.
Not even just a little snack.
No, make it tiny. Okay.
I'm a snacker.
Oh, you're a snacker.
I'm a big snacker. Can't help it. Yeah. Sometimes I wake up in the middle of the night if I am training hard and need a snack.
It's just not long enough to get you through. Eh?
Yeah, that think's more just a reflection of my poor eating habits. And when it comes to injuries specifically, does it mean that if you're injured and you're needing more recovery, does logic dictate that you now need to sleep for 12 hours? It
doesn't seem so. It seems like the sweet spot is whatever your sweet spot is. That's somewhere in that 7 to 9 hours. And the only time is illness. That's where you might end up sleeping a lot more. But that is illness. Otherwise, injury itself doesn't seem like it needs lots of extra sleep. I certainly haven't found any research to state that, and I haven't noticed that with patients.
Yeah, sleep, as simple as it sounds, it's often elusive and hard to be disciplined on.
Yeah, I also think it's underappreciated. We just don't realize the importance of it. There's some of the sleep gurus out there doing all the research. So to sleep too little is to die sooner. Because it's just going to up all your negative health scores, and it's going to increase your risk of, cancers and Alzheimer's and diabetes and all that kind of stuff. And, we also think a lot of this teenage anxiety that seems to be exploding all over the place is because these kids aren't sleeping enough. It seems to be, part of what's driving it. Maybe not all, but certainly part of what's driving it. So I think the importance of sleep is just being completely under the radar, and just hasn't had much publicity.
Snorers, is any help for them? There's a lot of them in our race villages. They have their own tents set up far away from all of us. Snoring disruptive for the people around you, but probably disruptive for yourself as well, right? I mean, it's
certainly something that should be checked out if you are a snorer. So you might have sleep apnea, and that means we actually stop breathing in between those snores, and you're waking up the whole time. So you're not getting into those deeper phases of sleep, and certainly worth getting that checked out at a specialist, a pulmonologist, or one of the sleep clinics, and getting that figured out. Because if you are continuously waking up or have sleep apnea, getting that sorted out is just going to boost your performance through the roof. It's going to change you as a human being, So, but also it's just going to decrease all your risks of heart attack and stroke and all other kinds of things. So get that fixed.
So in other words, sleep more, you're able to push harder, perform better across the board, lifestyle, everything in between. It affects your diet, affects your risk of injury prevention. It's pretty much the glue that holds everything together.
Affects your decision making, make you resilient. Yeah, it is this glue that holds us together.
Power of sleep, eh?
The power of sleep.
Well, Rob, thank you. I've learned a lot today.
My pleasure, Doug. Thanks for having me.
And I hope that all of you have too, and that you get to bed at night at 8 o'clock, hey? 8 o'clock.
8 o'clock.
For us Balis, no Netflix. Yeah. Thanks, Rob.
My pleasure. Thanks a lot for having me, Doug. Cheers.
This podcast is proudly brought to you by Rest Tonic, whose purpose is to enable well-being and success through the power of sleep.